Hey guys, welcome back to Pediatric Therapy Essentials. Well, in this week's video, we are talking about lifting and back safety and how to make sure you stay pain-free, so stick around. Hey everybody, welcome back to Pediatric Therapy Essentials. My name is Dr. Heather Sossaman and I'm a pediatric physical therapist. Well, as I said in this week's video, we are talking all about lifting. Now, lifting is something that each and every one of us do on a daily basis, whether we think about it or not. We could be lifting the laundry out of the dryer, carrying groceries in from the car, or if you work where I do or you have a special needs child, you could be helping lift a person during your day. But no matter what you're lifting, the basics and the techniques of how to do it safely and properly remain the same. So in today's video, we're going to review how to properly lift and the do's and don'ts to keep you healthy and safe. So the first thing we want to think about is what we're wearing. And I know that sounds a little bit strange, but our clothes can get in the way of doing a lift properly and might even cause us to trip or fall if we're not dressed properly. So I always recommend that you wear a nice pair of shoes with a sturdy sole, usually a good tennis shoe or something that keeps your foot in a good position and doesn't allow you to slip. Second, you want to make sure that your clothes are loose fitting, but not too loose. We don't want to get our legs wrapped up in our skirts or not be able to do a nice wide squat because what we're wearing is too confining. So well-fitting shorts or pants are usually what I recommend. Second is the big one. I know everybody has heard people say, lift with your legs and not with your back. And I think that phrase is important and true, but I also think it's a little bit confusing. So our back muscles do participate in lifting, but their job is not to power the lift. Instead, their job is to keep your back, trunk, and torso in an upright and solid position. So they help us to maintain posture while we're lifting. The actual action or movement of lifting does happen from our legs. So our hips and our knees and our ankles are what are bending down to pick up the load and powering us back up into the standing position to perform the lift. And the muscles in our legs were designed to do that, right? Our glutes, our hamstrings, and our quads are all really big, powerful muscle groups that were meant to push our body up and down. And that's the way we need to use them. All right, so let's talk about the steps of a lift. The first thing we want to do is get our feet in a nice wide stance so that we have a big base of support underneath us. And that means that we have a large area in which to balance ourselves as we do the lift. If you think about when your feet are close together versus farther apart, it's much easier to balance and keep yourself stable when your feet are wide apart. Now that we have a nice wide base of support, we want to lower our body down to pick up whatever load it is that we need to grab. And to do that, we want to bend from our hips and from our knees, slowly lowering our body to the ground while we keep this upper part of our body nice, firmly upright in a good posture. Now, to get yourself down to that position, you've got to bend through your hips and knees, keeping most of your weight back through your heels. And if you've never done this before, you could feel a little bit silly, like you're sticking your tush out really far. And if that's how you feel, you're more than likely doing it correctly. Once we've lowered ourselves down to the load, we want to grab the load, pull it close to our body, using our core muscles to keep everything stable. And then we want to use those big, powerful leg muscles to push us back up to the standing position. Now, as we're doing the lift, we want to remember that we need to keep the heavy item close to our body. And we talked about this last week when we talked about backpacks. The further away you keep a load from the center of your body, the heavier the load becomes. So if you think about a gallon of milk, if you hold it really close to your body, it weighs what you would expect a gallon of milk to weigh, right? But the further and further you push that gallon away from your body, the heavier it becomes. So the same thing goes when you're lifting a box or a person. You want to keep everything close to your body so that you can keep your posture upright, not hunching forward or arching backwards, and be able to lift the load. Now that you've picked your load up, you need to put it down. And when we're putting the object down, we need to remember that we don't want to twist or turn our body to put the object either maybe on a table, or if it's a person, into a wheelchair or a changing table. We don't want to twist as we do that. That's a recipe for disaster with your back. We want to use our legs and take steps to move toward our end location and then carefully put the load down. And last but not least, we need to remember that there's absolutely nothing shameful or embarrassing about asking for help when you lift. When you're lifting with a partner, you're each carrying part of the load and you have someone there for backup to make sure that things are going smoothly. All right, so let's do a quick wrap up. To lift properly, we first need to make sure that we're wearing the proper type of clothing and attire. Next, we want to make sure that we're standing with a nice, wide, stable base of support. Then, we want to make sure that we're slowly lowering our body down to the load we want to lift, using our legs, our hips, and our knees to bend our bodies down to get there, and engaging our trunk muscles in our core and back to make sure that our spine and trunk stay in a nice upright position. We're going to gather up that load, keep it close to our body so it doesn't put too much pressure on us, and use those big strong muscles in our legs to power us back up to the standing position. Once we're standing, we're not going to twist or turn our spine to put the load down. We're going to use our feet to safely take some steps, and if we think that that load's too heavy, we're absolutely going to ask for help. And please remember that if you're having any kind of pain in your back or spine, or you're having difficulty with lifting, reach out to a medical professional, whether that's a physical therapist or an occupational therapist or your general practitioner, to get some guidance and information on possible pain or your body mechanics. Because our spines are incredibly important and we want them to stay healthy for our entire life so that we can do the things we want to be able to do. All right, everybody, I hope you learned something new today. I appreciate you stopping by, and if you did enjoy this video and learn something new, please remember to give it a thumbs up. And if you enjoy videos like this and you haven't subscribed to this channel, please consider doing so. Well, I hope each and every one of you has a wonderful week, and I will see you next Saturday. Bye!